Hi everybody, this is Footsteps to Fertility and I'm Dr. Wanjiru. So this month we've been going through the series on male infertility as part of the series for the Men's Health Month. And we've had a few questions and queries from people who are watching the videos, and I thought it would be nice to share the questions and the answers for everybody to learn together. If you're interested, do keep watching. So on our question series, we're going to start with a young guy who wrote in and asked about the use of steroids and male fertility. What will it do? And I don't have any information, but from the research, I get that a lot of younger men now are using testosterone and hormone therapy to bulk up. We're the get it generation who do not want to do the work, and I say that with confidence because we don't want to do the work, we want to have muscles tomorrow. And obviously there are things that will enhance that. If we take testosterone, we will bulk up and be able to look good very fast. But what is this doing to our body? And I just want to say that this is harmful to our sperm. And if taken long enough, it could cause permanent, irreversible damage to your sperm. And so what testosterone does, it's the male hormone. It's what makes you have beards. It's what gives you broader shoulders. It's what gives you the libido and the drive to be a man. But if we take it orally or inject it into ourselves, then what we're doing, we are stopping the natural production in our own bodies. And for us, or for men, you need testosterone in your testes to produce the sperm. So once we do that, then we are affecting the sperm production in the testes. And what usually happens if it's taken long enough is that the testes shrink. And another thing that happens, sometimes you lose libido. So if you take it long enough, and some people say about a year, you will cause irreversible damage and hamper with your future of getting children. So I think it's important for men to know this, and I hope I've answered your question. Stop it. There are other things that you could do to bulk up in the right way in terms of nutrition and exercise. We don't need to use the steroids. The second question was from somebody who wanted to understand or question whether having abnormal sperm will lead to having children with birth defects. And I thought this was a really good question to answer because the answer is two-faced. One depends on what we do, and what genetic effect that you're looking at. So research has shown that children born from patients who were having difficulty conceiving and did an IVF or an IUI have no higher chance of congenital defects, meaning they don't have higher chances of anything that could be done in the birth defect. It is actually the same. This being said, we are right now seeing an increase in male fertility problems in boys who were born of fathers who had male problems. So it's very clear, or it's coming out clearly now, that if your father had lower sperm counts, then even when you get a child through our IVF ICSI, where we actually inject one sperm into the egg, if it is a male child, he has a likelihood, not a very high likelihood, but there is a likelihood that he will also have a bit of problems with his sperm parameters. So this is something that we caution and that we tell our patients, but generally in terms of any other genetic effects, there is no increase in terms of IVF babies and other babies. So the third question is from somebody who was asking about what they should do when they have a diagnosis of obstructive azoospermia. What obstructive azoospermia means is that the man has sperm in the testes, but the tubes are blocked, either because of surgery or because of infection or because they had a vasectomy done. So this couple wants to know, should we reverse the vasectomy or should we just go ahead and have the testis examined and sperm extracted directly from the testis and go on into an IVF ICSI cycle? I think that's a hard but easy question to answer. I'd say that the possibility of having the surgical correction done for the tubes is very, very difficult. I think less than 0.1% are corrected. So the chances are very low. So for me, if you asked me, I would say that it would be easier and less time consuming to have an IVF cycle with testicular sperm extraction done. Though I would like you to probably see a urologist as well, get their feel, but ultimately most couples will come and have a TESA, which is testicular extraction of the sperm with an IVF cycle, and it does work. It does work. So I hope I've answered your questions adequately, and I hope other people have learned from these 3 questions. I would say that it's important for us to learn and get as much information about our bodies as we can, because only through that do we succeed in this fertility journey. So if you enjoyed the video and learned something, feel free to share it with somebody who also probably needs the knowledge. Like our channels, subscribe to our YouTube channel, and if you want more information, feel free to contact us on any of our media points. This is Dr. Wanjiru, and you're watching Footsteps to Fertility.